Welcome to the RCI GDAS webinar titled Mental Health and Dementia and Disability Issues Application to Practice, presented by Katie Knies. Before we get started, let's cover a few conference details. If you have a question during the conference, we ask that you type in the question. All questions will be answered at the end of the conference. Also, if you are at your own computer station, a post-test survey will pop up at the end of the webinar. There will be 10 questions about the webinar and personal information questions such as name and email address that will enable me to send you your certificate. If you are not at your own computer, copy down the link that is posted on the last slide of the presentation. Use the link at your own computer to complete the post-test. Certificates will be sent within 1 week after the closing of the test. Please complete the test before April the 22nd to receive your certificates. We are now ready to begin. Welcome, Katie.
Thanks, Elaine. Happy Friday, everyone. Good morning. Thank you for attending this webinar. Hopefully you all have come to the right place, but we will be covering a variety of mental health and dementia issues for the next 45 minutes. Okay. So specifically, the focus of my presentation will be on care planning, especially with those who lack social support, how to talk to a client when you're only seen, I think I'm on the wrong, I am on the right slide, excuse me. How to talk to a client when you are only seen as just another health professional who is rushed and just checking you off their list. How to help caregivers cope with a loved one who has been diagnosed with dementia, and lastly, medications that are commonly used and how to help those clients who cannot afford them gain access. Okay, so just wanted to start with a brief overview of dementia. Dementia is an umbrella term that is used to describe many different conditions that affect the brain. Each generally leads to a decline in mental ability, and most people who develop dementia are older adults, 65 and older, and especially those over the age of 85. So here in this graph, we see that in 2005, the number of people aged 65 and older in the U.S. was 36.8 million, which was about 12% of the total population. By 2030, the number of older Americans is estimated to reach 71 million, or roughly 20% of the U.S. population. So we can see how important it is to start preparing. Okay. So executive functioning is something we often take for granted. Unfortunately, it becomes a major victim for dementia. Activities of daily living become daily obstacles, and in some instances, hazards. This is where we see bills forgetting to be paid, trash not taken out, stoves left on, decline in hygiene, and for those who still drive, getting lost in familiar places. This is also where we see interpersonal problems. One, directly from the executive dysfunction in terms of understanding and communication, but also with the frustration and denial that comes as a result. I will definitely get more into the frustration and denial a little bit later on. Okay, so you can see in this graph, because of these interpersonal issues, we see the #1 type of behavioral problems reported in nursing homes is resistance to care. So as we get into the focus of this presentation, it is important to keep in mind a few specific strategies when working with a client who has dementia. 1, every client is different. Every case has to be individualized and adapted specifically. 2, similarly, when an intervention works at one time, it may not work every time. So no day is the same for someone who has dementia. There are definitely good days and bad days. So 3, the key is flexibility. And lastly, possibly one of the most important to consider is the environment triggers the behavior. So too many stimuli can be overwhelming and result in a meltdown. Okay, so how do you care for a client who lives alone with no social support? Each person with dementia is unique, and so the situation in which they find themselves. While most people live with a partner or in some type of family situation, increasingly many people live alone. This may be by choice or by circumstance. Whatever the reason, it creates a particular challenge for people who care for someone with dementia who lives on their own. A diagnosis of dementia does not automatically mean that a person is immediately incapable of caring for themselves. Assisting a person to remain in the familiar surroundings of their home for as long as possible is definitely a worthwhile goal. The type of support required depends on every situation. A person living alone might forget to eat or take prescribed medication, forget to bathe or change their clothes regularly, lack awareness of potentially hazardous situations such as fire or electrical appliances, show poor judgment about who they let in the house, have unrealistic ideas or suspicions which can lead to trouble with neighbors, the police, or even in the community. And they also might forget to feed or care for pets. Some of these situations can be dealt with fairly simply. For instance, if the person is forgetting to eat, arranging delivered meals such as Meals on Wheels, then making a phone call or having someone visit to remind the person to eat the meal may help. Other situations, however, may compromise the person's safety and well-being, in which case a move to more supervised care may have to be considered. So where do we begin? Aged care assessment teams, also known as ACATs, help people with dementia and their carers work out what kind of care will best meet their needs and when they are no longer able to manage at home without assistance. ACATs provide information on suitable care options and can help arrange access or referral to appropriate residential or community care. Additionally, ensure that the house is well lit and there are no hazards such as faulty kitchen appliances, loose carpets, or unsteady furniture. Some aids to independence include rails near the bath or the shower, easy-to-read clocks and large calendars which can help orient to date and time, personal alarms, reminder timers, particularly for remembering medications. Additionally, as dementia progresses, the person's ability to make financial and legal decisions may decrease. The person will need help in managing finances. Getting legal and financial advice while the person can still participate in the decisions is essential. Also, explain the person's condition to friends, neighbors, local shopkeepers, people neighboring local police, and provide them with contact numbers. These people can be very helpful in keeping a tactful eye on the person with dementia. Ensure that the person has an adequate identification and an emergency contact number when they go out. So where else can you get help? The client's doctor, local community health service, local council. The Independent Living Center in each state and territory actually offers a number of services designed to promote safe living. Information is available on products such as smoke detectors, hot water service temperature regulators, and monitoring services. Advice is also available on home modifications and home design. Contact numbers for independent living centers can be obtained from the phone book or online. Okay, so, as we talked a little bit before about dealing with denial, there are definitely some values to keep in mind. The best approach when dealing with a client who is in denial is person-directed care. This approach returns decision-making and choice to the client. It enhances the primary caregiver's capacity to engage with the person and respond to needs, and it establishes a home-like environment. We are looking for means to prevent, delay, or slow a person's decline through medical and psychosocial interventions. It is important to have a clear and accurate understanding of a person's background, abilities, tastes, interests, values, and even spirituality. Dementia is a disability of certain parts of the brain. There is much we can do through insight and skill to reach the person and increase quality of life. Behavior should be viewed primarily as attempts at communication related to unmet needs. The caregiver needs to seek the meaning of the communication and to address the need. When we think about the core psychological needs of a person with dementia, we need to remember that this illness can really derail a person's quality of life. We need to find ways to help boost their self-esteem, still feel useful, still be able to care for others, and also both give and receive love. Okay. So some clients you take care of are definitely confused. It is important to understand confusion and how to care for these clients. The client who is confused may have problems with their memory of recent and past events. They may have forgotten how to perform well-learned skills such as dressing themselves. Loss of orientation to person, place, and time. Language problems, visual and motor problems are also very common. Some clients may have trouble problem solving and using poor judgment. So clients who are confused have changes in their actions and behaviors. A common memory problem is the inability to remember recent events. They may not remember what they just had for breakfast. Personality changes including mood swings, suspiciousness, and delusions may be seen. Disorientation is another common symptom. The confused client may have difficulty remembering the day of the week, season, or even the time of day. They may not be able to find their way around their home or neighborhood and may not remember the names of people whom they have not seen for a while. The confused client may stop socializing with others and neglect established friendships. Additionally, language problems called aphasia are frequently seen in confused clients. The client with aphasia may have a hard time understanding what is said to them or following directions. They may also have problems with speaking and repeat words over and over. Some clients have problems with judgment and may lose their social skills and make unsafe choices. Many confused clients have problems with everyday activities. They may need to help with dressing, bathing, and meals. Bowel and bladder incontinence may develop, and changes in sleep patterns are also very common. However, some clients do not really appear bothered by their confusion. They're pleasant and agreeable when care is being given to them, but other clients do have a hard time dealing with their confusion. So they often respond in physical, behavioral, or in functional matter. Communicating with the client who's confused can be extremely challenging, as you all may know. Validation therapy uses empathy to help people regain dignity, reduce anxiety, and prevent withdrawal. It also assists caregivers to communicate and avoid burnout and depression. The foundation of validation therapy is based on the following beliefs. All people are unique and valuable. There is a reason behind the behavior of this disoriented client. The disoriented client cannot be forced to change his or her behavior and must be accepted non-judgmentally. When recent memory fails, older adults restore balance to their lives by retrieving earlier memories. When an empathetic, trusted listener validates feelings, anxiety diminishes, trust is built, and dignity is restored. So an example of this, I'm going to give a brief little situation, is, Glenda is a 9-year-old client with severe dementia, and she's wandering around the house calling for her mother. She's very distraught and wringing her hands as she looks in every room. So validation therapy would be something like, Glenda, why are you looking for your mother? Can you tell me about her? Do you need someone to do something for you? Effective communication takes practice. It is important to remember that when validating the client's feelings, you should not feed into the confusion by making statements such as, I just saw your mother a few minutes ago, or I hope you find your mother. It is believed that the confused client may be able to realize that he or she is confused by taking part in this confusion. So otherwise, the caregiver would definitely undermine the client's trust. Okay, so I briefly touched on this before, but too much stimuli can often set clients off. The sensitivity of people with dementia stretches beyond sensitivity for actual physical conditions, for instance, to operational factors. Invasive technology like lights switching on, seemingly spontaneous, curtains moving, and noisy ventilation can definitely cause clients distress. Stability is key. Routine is key. Create a cluster-free environment, removing misleading stimuli and minimizing background noise such as the radio or TV, and put items away when not in use. Okay, now moving on to talking to a client when they see you as just another healthcare provider who has very little investment in them. We all know that working with older adults, they're so used to a lot of different caregivers, and they're often used to waiting for a long time or often being brushed off, so it can be sometimes difficult to really create a connection with them. So let's keep in mind that we want to treat the client with dignity and respect. Respond to feelings, display empathy and interest. Know the client as an individual, so get to know, some of his likes and dislikes. Always introduce yourself, call the client by name, and explain what you're doing as you approach the client. Speak softly and in a low-pitched voice. Approach the client from the front, moving slowly and gently without startling him. Establish and sustain eye contact with the client. Speak in short, direct statements and repeat key words to promote understanding. Always get the client's attention before commenting or asking a question. As soon as eye contact is made, begin speaking because the client with dementia has an attention span that may only last a few minutes or even seconds. Explain each task by providing short, one-step directions. Ensure that all tasks are simple and manageable. Show the client how to begin a specific task. Ask questions that are short and to the point. Ask questions one at a time. When repeating the question, ask it exactly the way that you did before. Use nods, pats, gestures, and smiles, and other meanings of nonverbal positive communication. Be consistent with gestures. It only adds to the client's confusion if you use a gesture to mean one thing one time, but something else a different time. Provide sensory stimulation if appropriate using music or touch. Encourage clients to talk about their families and past experiences if they desire. Observe and report signs of infection, including an elevated temperature. Observe and report changes in thinking or memory. Okay, so now after establishing an initial connection, there are also specific strategies to help maintain this relationship. It is very important to remember that the person with dementia remains an adult in his or her own right. Having a diagnosis of dementia does not take their humanity away from them, and indeed for a long time, they may be able to live a relatively independent life. The best way to support them is to continue to treat them with respect and dignity and listen and try to understand their experience. They will still express their thoughts and emotions, although as time passes, you may need to learn to understand them and communicate with them in a new way. Even though they have a disability, it is important to remember that they will not want to be treated like a child. This is huge. I cannot emphasize this enough. Encourage them to carry out daily tasks on their own and continue to do things which they have always enjoyed. Having dementia may change what a person can manage over time, but it will still be possible to celebrate and support what they can do. And you know, as we know with the older adults, this population, especially men, you know, they're used to being the man of the house, the man of the household, really being the provider. So sometimes this takes an extra toll on them. As with any relationship, the key to success is listening, understanding, being supportive, and making a real effort to connect with other person's experience. We need to feel cared for and understood, and people with dementia are no different. One of the most important skills to learn when being with someone with dementia is to realize that when their thinking skills aren't working as well, they're probably going to rely heavily on their emotions to express themselves. Paying attention to nonverbal signs of emotion can help you listen to and communicate with them more effectively. I mentioned this a little bit before, but try to help them follow a daily routine. This can stimulate their memory, reduce confusion, and help them keep feeling balanced and calm. Similarly, keeping decisions simple, breaking down tasks into lots of small steps can reduce the chances of you and the person with dementia becoming overwhelmed. Using memory aids such as pictures of family and friends or a notebook or diary, which reminders can be written, may also really help stimulate their memory. Okay, so another focus of my presentation is the feeling of losing someone to dementia. And this is definitely something that you can communicate with the caregivers of your clients. It is important to realize that shock and denial are common. Many people faced with this terrible diagnosis hope for a quick cure or hope that the diagnosis was wrong. Anger is a major component of the process and can either tear the couple apart or bring them together at the beginning stages of the disease process as they forge a new relationship in this uncharted territory. Dementia is certainly depression is certainly a risk in going through this process. Similarly, never-ending grief of living with a person with dementia, as well as for the person with dementia, he or she loses their independence and daily functioning. Guilt is also very common, and a loved one, typically feels guilty going on with and enjoying his or her own life. As you know, and I know RCI really emphasizes this, caregivers need caregiving too. So it is important to relay this information to your caregivers. Allow yourself to feel your anger and use it productively. This can be a time of deep questioning of one's religious and spiritual beliefs. Talk about those questions with friends and clergy. This dark night of the soul can ripen into a deeper spiritual strength, which is an invaluable inner resource in the grief process. Express yourself. Journal writing, drawing or painting, dancing, exercising, getting those churning feelings out, expressing them is really vital in preventing depression and burnout. Speaking of burnout, take time for yourself. As first you're going to feel guilty, but however, nourishing alone time, walking in nature, exercising, having a massage, hanging out with your friends is vital in preventing burnout. If you burn out, you won't be able to be there for yourself or your loved one. As they say in the safety announcements on an airplane, you need to put your own oxygen mask on before you can help the person sitting next to you. So join a support group with others who are losing a partner to dementia. These can be super helpful. The Alzheimer's Association has a tremendous wealth of resources to support family caregivers, and this can be accessed online. Speak to a therapist or a counselor who understands the process of grief that you're going through. Use that time as your own special sacred time to deal with all the feelings you are going through, including feelings about other losses and hurts in your life that may be surfacing. And, while friends and family can be great supporters, therapists and counselors, they've been trained in the tools that can help you overcome your grief. Okay, we're nearing the end here, and we're just going to talk a little bit about a medication. There are several drug treatments that are thought to relieve some of the symptoms in dementia. However, they do not work for everyone, and they are not a cure. The most common of these are known as cholesterol inhibitors, and use the drugs Aricept, Exelon, and Reminol. You probably have heard of these. These drugs can slow down the progression of dementia, allowing the person to enjoy a longer period before the onset of very severe symptoms. So remember, these are drugs that are often given at the very beginning of a diagnosis. In January 2011, the National Institute for Health and Clinical Excellence ruled that these three drugs could be prescribed with people for mild dementia, as well as those with moderately severe dementia. Another drug, Abixa, is recommended for people with severe dementia and for some people with moderately to severe dementia. Your geriatric practitioner or specialist will be able to advise which drugs may be suitable, and people with vascular dementia may be given drugs to thin the blood or correct irregular heartbeat, which may help reduce the symptoms of stroke. Now, in terms of helping clients who may have difficulty affording medication, there are patient assistance programs, also called PAPs, and they're programs created by pharmaceutical and medical supply manufacturers to help financially needy patients purchase their necessary medications and supplies. Eligibility requirements and benefits of patient assistance programs are determined by each individual pharmaceutical company or medical supply manufacturer. There are programs designed for patients that do not have insurance and other programs for individuals whose insurance copayment amounts are prohibitively expensive for their income levels. Still, other programs are designed to assist those with specific types of insurance, such as Medicare Part D. The duration of one's enrollment in a patient assistance program also varies too, which is something to keep in mind. Some programs require participants to reapply with each new prescription, and others require just an annual reapplication. Most programs will provide a 90-day supply. As we conclude today, it is important to remember a few key points. Caring for someone with dementia is often demanding, but there are lots of places to go for help and lots of information which can help make sense of the experience. Dementia often progresses slowly, and many people with a diagnosis live happy and fulfilling lives for a long time. But while it can be difficult, subject to discuss, caregivers often say how important it is to make plans for the future with a person who has dementia. Try to help them follow a daily routine. This can stimulate their memory, reduce confusion, and help you keep them feeling calm and balanced. Similarly, keeping decisions simple, breaking down tasks into lots of small steps can reduce the chances of you and the person with dementia becoming overwhelmed. Again, using memory aids such as pictures of family and friends or a notebook and a diary, which reminders can be written, will also be extremely helpful. One of the most important ways that caregivers can help people with dementia is to ensure that they take care of themselves as well. Being support for someone with dementia can be exhausting, and while many caregivers feel they have to spend their energy on the person they are caring for, it is imperative to realize that they need looking after as well. It is very important to remember that the person with dementia remains an adult in their own right. Having a diagnosis of dementia does not take their humanity away from them, and indeed for a long time they may be able to live a relatively independent life. The best way to support them is to continue to treat them with dignity and respect and listen to and understand their experience. So thank you again for attending this webinar, and I hope you all gained a little more insight into dementia caregiving. So Elaine, I'm going to turn it back over to you. Okay. I don't hear Elaine, but I'm looking next to me, and I'm seeing that, can you discuss the use of Seroquel to treat dementia patients? I have to be very honest with you. I'm not really sure about the individual influences of each medication. I definitely suggest looking up on WebMD to get more information. So I'm sorry I can't give you more specific information about that.
That's not a problem. As you see, we have forwarded to the next slide for the post-test, and if you're not at your own computer, be sure to copy down at least those last numbers to SurveyMonkey, letters and numbers, excuse me. And there we do have another question from Kristen.
Right.
What was the last one in the list of medications you mentioned? We can slide back if you want to.
Okay, sure. I don't think it's on this slide, but it's Ebixa, and I can spell it for you. It's E-B-I-X-A. So again, that's recommended for people with severe dementia and for some people with moderately to severe dementia.
Okay. Is there any more questions? We've kind of gotten through a little bit early. Katie was kind of a fast talker today. That's okay. It's a Friday, Katie, and as you know, things have not been going too good for us this morning getting started. So we're good. Let's give everyone a chance to see if there's any more questions. And we do appreciate it. So many of the things that you said, you know, especially for caregivers taking care of themselves, you know, it's a hard thing for them to understand, but all right, here we go. What medication, from Janet, what medication is needed to treat behavioral problems?
Okay, so that's a good question too. It depends what types of behavioral problems, but there's often antidepressants, anti-anxiolytics that can be used. But you have to also be careful because we know that older adults are on a variety of medications. You know, I'm really used to writing down at least an average of 10 medications, so you have to be careful with side effects and then the interaction of the drugs.
Yes, I would think every time you visit your care provider, you always need to take your medicines with you, especially if you do think that you could be adding a new one to the list. So.
And yeah, you know, it is the best if they bring them, or a lot of older adults I work with have a list, and unfortunately, you know, a lot of them don't even know what medications they're on. It's usually their caregiver that knows.
Okay. Lisa is asking, any suggestions for night waking and staying up throughout the night? Oh, that happens to me too now.
So again, there are various sleep aids. I know a lot of older adults are on Ambien, but they have to be very careful about interaction with other drugs. Also, I don't know if you're aware of melatonin. That's also given to everyone, but older adults especially because they don't produce as much melatonin in their older age. So that it comes in, I think, starts in like 1 milligram or 2 milligrams, and all the way up to 10 milligrams. So that's something you can definitely start taking about a half an hour beforehand. And again, I think for general sleep habits is to have a really calming routine before bed. No distractions, maybe some chamomile tea, maybe a nice hot bath. But yeah, generally I would say some sleep aids would probably be the best route.
Yeah, I just discovered the other day sleepy time tea, and it seems to be helping me.
It does. Yeah, it really does.
Because I think it contains that chamomile. And the other day I went to visit someone, and she was wearing an Exelon patch, and I did not know that those came in patches also. I thought everything was just in pill form.
I know. It's amazing what they come up with, right?
Yeah. So, okay, any more questions? We'll hang out here for a few more minutes.
Okay.
Anything else you can think that you'd like to share with us, Katie?
I don't think so. I hope maybe if anyone else has a few more questions. Again, you can't emphasize enough that caregivers need to take care of themselves too. And, I didn't touch upon it as much, but not only the caregivers who can suffer from depression, but the older adults who receive a diagnosis of dementia can suffer from depression and anxiety as well. And that's something definitely to get checked out because it can often be really difficult to tease apart, what are symptoms from dementia and what are true symptoms of depression and anxiety. So that's something to really keep in mind.
Yeah, that's a good point. And I know, we've been doing some assessments here, doing some screenings lately, and it seems that people either really want to know or they don't want to know.
Right.
And I know personally a lot of people don't want to know because then they think it's something else to worry about. But on the other hand, if you do know that you may be in early stages or, you can start taking this medicine and
definitely. And you can start planning for your future.
That's exactly right. And I know, for instance, when I took it, it was a relief for me because sometimes I think all the things I forget, and then I realize maybe I'm not quite so bad. So you're absolutely right. Well, it doesn't seem that anyone else has any questions, and we made it through the webinar, Katie.
We did, and I apologize if it was a little too quick.
No, it's fine. You're fine. You just were a fast talker, but you covered all the points, and I just want to remind everyone that it will be archived on the Rosalind Carter Institute website, and I will send that link out via email to everyone who is on our listserv, and we do appreciate it, Katie, and we hope that everyone has a great weekend.
No, thank you. Thank you for everyone for attending.
Thank you.
Bye.
Thank you. Please stand by.